In the year 1974, Radda Barnen, the then Swedish Save the Children, initiated a mother and child health project with the approval of the Ministry of Health and Family Welfare in Mirpur area under Dhaka Metropolitan City. Radda Barnen, Save the Children Sweden, handed over the management of the Radda MCH-FP Center to a 6-member Board of Trustees of Radda MCH-FP Center Trust in September 1994. The Trust is a non-government and non-profit organization set up under the Trust Act of 1882. Radda MCH-FP Center now provides full range of primary health care and ancillary services for mothers and children and the adolescents of the underprivileged and underserved population of the area. It also works for human resource development and conducts training and research in the related areas. Aim: the Radda MCH-FP Center aims at improving health and quality of life for families, with particular emphasis on low-income and disadvantaged ones of Dhaka urban slum of Dhaka North and Dhaka South City Corporations. The primary focus is providing preventive and curative health care services to mothers, children and adolescents and physiotherapy services. The center also provides family planning services and designs and conducts activities for human resource development through training and research. Gradual expansion of these services to cater the whole range of entire community health and related services is the long-term objective. Mission: to develop a sustainable organization that maintain a leading role as provider of affordable, high-quality preventive and curative health services to the community, with primary focus on mother and children. Build a leading training institution based on our competitive advantages, providing high-quality training courses based on recognized standard curricula or tailor-made to suit multiple customer needs. Initiate projects and research activities of relevance and direct benefit in respect to health, nutrition and well-being of the mothers, children and adolescents of poor and marginalized groups in particular and the community as a whole in general. To build up financial sustainability from service charges affordable by target clientele, income from sustainability fund, clients' contribution and donor support. Board of Trustees: Mr. Qazi Fazlur Rahman, Chairperson of Radda MCH-FP Center Trust; Mrs. Tarunnisa Abdullah, Treasurer and Member of the Board; Professor T.A. Chaudhary, Member of the Board; Mr. Mahbubur Rahman, Member of the Board; Mr. A.S.M. Kashim, Member of the Board; Professor Jamilur Reza Chaudhary, Member of the Board. Dr. S.M. Mohyuddin Kamal, Executive Director, is the Principal, Radda Paramedic Institute and Secretary to the Board. The Board meets once in 3 months, but if necessary, they are available whenever it is required. The Radda MCH-FP Center Trust is responsible for the overall management of the center. A 6-member Board of Trustees comprising of health professionals and social workers are committed to address the primary health care needs of the rapidly increasing population of the urban poor and the slum dwellers. The Board of Trustees meets at least once every quarter, but the individual members are available for consultation, technical advice and guidance whenever needed. Management of Radda MCH-FP Center. Day-to-day operations and management of the center is the responsibility of the Management Committee, headed by the Executive Director. The Management Committee includes all the heads of the programs. Objective. Components and services. It has 5 main components: maternal child health and family planning services, community health services, training and research, Radda Paramedic Institute, administration and accounts. Staff position of Radda MCH-FP Center. Total staff strength is 200, including regular, contractual and part-time. Service levels. MCH-FP service delivery takes place at 3 levels. Working hours of the clinics. The routine working hours of the clinics are from 9 a.m. to 5 p.m. on all days except Friday and government holidays. MCH-FP program. Services delivery at Radda MCH-FP centers. Comprehensive reproductive health care. Child health. Community health program. Same services are provided by the MCH-FP department at the community level. Non-EPI vaccines available are hepatitis B, hepatitis A, typhoid, MMR, chickenpox, rotavirus, diphtheria and tetanus, meningococcal meningitis, cholera vaccines, cervical cancer vaccine, hexavalent, pneumococcal vaccine, Japanese encephalitis, yellow fever, influenza vaccine, and anti-rabies vaccine. These vaccines are available from all static clinics of Radda MCH-FP Center only. Diagnostic Services. The center has pathological mini laboratories at 3 main static clinics. Sonogram. The facility is available at 3 of its static clinics at Mirpur section number 1, 10 and 12. Physiotherapy Services. Provides physiotherapy services to the entire family, including old and disabled member of the family. Nutrition and Dietary Services. Since inception, Radda has been working to improve the nutritional status of children and women and has experience to manage severe, acute malnourished children at the facility. Women and children who are suffering from underweight or obesity are getting dietary consultation services from here. Pharmacy. The center has 6 drugstores at the 6 static clinics. The drugstores have almost all essential medicines required for the treatment of primary health care services. Creche. There is provision of creche for the female employees of Radda MCH-FP Center, where children of up to 1 year are kept. Training. The training unit not only provides training to center's own staff but also runs a number of courses for other NGO partners and GOB agencies. Students from different GOB and private medical colleges, MPH students from NIPSOM and nursing students from various nursing institutes visit Radda MCH-FP Center as a part of their educational visit. Internship facility for international students. Students from Canada, India and Nepal also come here for their internship. Research. Operational research for the improvement of its own performance is a routine matter. Besides, a number of research programs which are relevant to our ongoing program are also taken in collaboration with different research organizations such as ICDDRB. A full-fledged training unit with 30-bed hostel facility is available. Radda Paramedic Institute. Radda Paramedic Institute has obtained the approval from the National Institute of Population and Training, NIPOT, State Medical Faculty and Bangladesh Nursing Council, BNC, under Ministry of Health and Family Welfare, MOHFW, for conducting 2 years community paramedic training course on September 2010. After getting approval, we started to admit the students who passed SSC and HSC. The students who have passed from this institute are employed in Radda MCH-FP Center and other renowned NGOs. Status of the students. In 4 batches, 60 community paramedics have completed their course so far, and in the 6th batch, 33 will appear for the final exams in June 2018. Collaborative activities. Radda MCH-FP Center is working in collaborative activities with the following organizations. Under the Community Health Program, Radda Plan Joint Project operates Urban Community Healthcare Project Mirpur, Pallavi, Kafrul and Mohammadpur Geneva Camp of Dhaka North City Corporation and City Polli of Dholpur, Malik Member Slum of Khilgaon and Match Factory Colony of Shampur areas of Dhaka South City Corporation. Radda Concern Worldwide, Improving the Life of Urban Extreme Poor Project, ILUEP project on management of severe acute malnourished children. Sustainability. The Trust is working towards the augmentation of its own resources and seeking collaboration and support from the government and non-government organizations both at home and abroad. Since taking over, the Trust has been able to maintain and improve the quality of care and extended the range of services. During the last years, gradually, the Trust has been able to raise its own financial contribution to the yearly budget from 9 to 100% without compromising the quality, at the same time improving access to the underprivileged and poor section of the population of the Mirpur area. The center is building up a sustainability fund with contributions from beneficiaries and other sources. Radda MCH-FP Center was awarded with a crest for Best EPI Performer Organization several times by Global Alliance of Vaccination Initiatives, GAVI.